May is Skin Cancer Awareness Month, and as we approach summer, where we're all going to be enjoying the season, we want to make sure that you're being safe. Here with me today is Dr. Ward and Paula, one of his patients. Hi, you two. So good to be here.
Hello. Thanks for having
Okay,
us.
so let's start first, Dr. Ward. How do patients discover skin cancer?
So often they notice skin cancer because it's a non-healing spot. You know, they might think it's a zit or just a little sore. Most sores, most zits aren't going to last several months. So if it's there, they need to get it checked out.
Okay, so and is that how you discovered yours, Paula?
Yes, I grew up with no sunscreen, and so I knew I'd have problems when I got older. And sure enough, I started having some skin cancer, some little spots that didn't heal, and I was always at the dermatologist making sure that I could take care of those. And most of those were not scary. Last September, it was a more serious, and it was on this part of my nose right here.
Well, I'm sure you panicked a little bit. It's your face, right? And seeing a hole in your face probably freaked you out.
It was traumatizing. It really, really was. Dr. Ward was able to take care of it well. I felt really comfortable with him, and I've been really pleased with the results. Side note, next week I'm having this Mohs procedure again, and again Dr. Ward will take care of any defects, and I feel confident with that. But that first time of having a serious one was difficult.
Oh, I'm sure. And seeing your before and after, you can see, I mean, and even looking at you, I'm like, wow, Dr. Ward, job well done. I mean,
oh, well, thank you.
You know, but after this, you know, then what happens?
Yeah, so I mean, the typical course when somebody knows that they have a skin cancer is to get it removed. And the way that we typically prefer to have that removed is with Mohs surgery, which is a very specialized type of dermatologist who removes the cancer, makes sure it's gone, and then they will often send it to us as facial plastic surgeons to reconstruct it. And that's kind of what we see here with the picture of Paula. We can see the defect on the nose. It was removed, had to go all the way down to cartilage, so it's a pretty big defect. Overall, it's kind of small, but on the nose, that is quite a bit of real estate that's been lost, and so we need to reconstruct it. So you can see the before and after here. It's a process. I think it's important for people to know that it is a process to get this thing treated, as well as for the recovery. It's not an overnight sort of process. And then the other thing that's really important is that we can't ever forget about screening, because they can come back. Like in this picture of Paula, you can see the little spot right at the top there. That's actually a new skin cancer that's there. We need to be careful of that. But I think it's really important also for people to know that we can reconstruct these, even for really large defects. We've got a picture here of a patient who's had a skin graft placed. Doesn't look very good there. About 10 years ago, another surgeon put that on there. We removed it and reconstructed it, and you can barely see it now. And then we can even do large defects, like this patient here who shows like a very humongous defect where about 3/4 of the nose was removed, and then we reconstructed that. So I want people to know that don't be scared of getting your skin cancer treated. We can treat it, we can reconstruct it, and you can get back to normal. But it takes time.
I mean, but it's just seeing the difference in those pictures and seeing how simple it could be or how big and graphic and massive, and you really can do the reconstruction, and you help ease the patient's stress and anxiety about it.
And no matter how many I get, I know he can fix it.
Good. That's why we always like Dr. Ward. So Dr. Ward, if they are somebody out there that is suffering or wants to talk to you, they can come in for a consult, I assume?
Sure. Yeah, look us up on social media at WardMD or wardmd.com.
No matter how small, how big, he can help you out. And don't forget to wear your sunscreen, right? I feel like that's an appropriate place to say it. Paula's like, make sure to do it. Dr. Ward, Paula, thank you so much.
Thank you.